Blue.
I would like to congratulate the Maori Select Committee on their comprehensive and profound report. I'd like to add to other comments made by previous speakers about smoking. I used to smoke. I smoked when I started. I was 16 years of age and I stopped when I was 30. I puffed away when I was a medical student. I puffed away when I was a health surgeon. I puffed away in secret mostly, in front of people who had lung cancer and dying and people who had emphysema. It's a disgusting habit and it is a terrible, terrible addiction. And I'm very pleased the government is putting $57 million into tobacco cessation products, because basically people who smoke are addicts and they need help getting off their addiction, which is tobacco. Tobacco smoking is the leading cause of preventable death in New Zealand. It directly is linked to 5,000 deaths each year. 400 of these deaths are attributed to second-hand smoke, and non-smokers on average live 15 years longer than long-term smokers. 13 New Zealanders, Mr Speaker, die every year from smoking, every day from smoking. Is an astonishing statistic. Tobacco use is linked to many diseases and cancers such as lung cancer, heart disease, stroke, chronic obstructive pulmonary disease such as emphysema or chronic bronchitis, and other cancers such as cancer of the mouth, pharynx and esophagus. The social costs of smoking are very difficult to estimate, but the life years are up to 62,000 life years lost to tobacco-related premature deaths, which is just tragic, and 19,000 quality-adjusted life years lost to tobacco-related illnesses. The cost is profound, personally, socially, and to the country. It's estimated by the Health Ministry that of the total of the health budget of around $12 billion, about $2 billion is attributed to the cost of smoking to the health system. But, Mr Speaker, for Maori, the impact of tobacco was significant and quite disproportionate. For the period 2000 to 2004, lung cancers were responsible for over 31% of Maori cancer deaths, compared with 17% of non-Maori cancer deaths. Cardiovascular disease death rates were 2 times higher for Maori than non-Maori during the same period. Deaths due to respiratory disease were 3 times more frequent in Maori than non-Maori. Smoking and tobacco use in New Zealand is a focus for the government, one of the 6 current health targets to provide better help for smokers to quit. And the targets for the current year state 80% of hospitalised smokers will be provided with advice and help to quit by July 2010, 90% by July 2011 and 95% July 2012. Similar targets for primary care will also be introduced from this year on. I think it's important. We heard an astonishing figure in the Select Committee. It takes about 14 times or 14 attempts for one person to give up cigarettes for smoking. That's a huge amount. Now, with tobacco cessation products, that goes down by half, possibly less. But it's a terribly hard addiction to break. And the triggers, such as tackling people in hospital while they're a captive audience in an inpatient setting, asking them about their smoking habits, giving them advice, even though they may not take that advice, it's just one trigger, it's one prompt to add on to the other prompts, and eventually that person will give up, eventually I'm sure, but it every bit helps, and tackling hospitalised smokers in hospital is one way to try and get to that smoker to convince them that it's a good idea to stop and give them the help they need, particularly, as I said, it's a terrible addiction. The tobacco cessation products, there's many varieties now. There's patches, there's gum, there's drugs, chemical type medicines that can be taken, all work in different ways to help break that addiction cycle. Earlier this year, Mr Speaker, we've heard the government did increase the excise tax on tobacco to reduce smoking, dissuade young people from starting to smoke, and that's a step in the right direction. All told, the excise has gone up almost 33%, and it will do by the time it's implemented in the next few years. All in all, the report that the Maori Select Committee came out with is primarily looking at innovative changes to New Zealand's tobacco control program, but also sets out the broad steps that we need to do to achieve the ultimate goal of being a smoke-free New Zealand by 2025. I congratulate the Maori Select Committee on this report. Thank you.